Thank you. I thank my colleagues, all 71 of my colleagues that have sponsored the John Zadroga Health and Compensation Act. And I thank all of you for traveling here to raise the awareness of members of Congress and to get more co-sponsors on this important and vital legislation. And I thank my good friend John Field. 6.5 years ago, shortly after that tragic event, John came to the first event that we had for the heroes, and he has been persistent and worked hard and started the Feel Good Foundation, and I thank him for his extraordinary leadership in trying to help others. I'm so pleased to see so many people here, and my colleagues from New York and my colleagues in Congress that are standing with us today, and I thank them for all their hard work and their efforts to get health care to everyone who is sick because of the deadly fumes, and monitoring to everyone, including school children and residents who were exposed to the deadly toxins. Over the objections of the administration, we worked hard, and last year we got $158 million in the budget to take care of the health needs of the responders. We need roughly 200, and our bill would make this program permanent so that the health care would be there throughout their lives. Should they develop cancers later on? Should there be other illnesses? We know that we lost 3,000 lives on 9/11, but thousands more lost their health. And many of these thousands are becoming sick as we speak today. Men and women who were well after 9/11 have become sick because of what the deadly toxins that pulverize glass, cement, and everything in their lungs. It's now beginning to affect them. So we have to be there, not just on day one like they were there for us. We have to be for them every single day for the rest of their lives. This $158 million provides care in 6 health centers, and I want to list them so you know where they are, so you can tell responders where to go. One is the New York City Fire Department, Mount Sinai Hospital, Bellevue Hospital, Queens College, Sunny at Stony Brook, and the University of Medicine in New Jersey. These heroes responded immediately. They didn't think twice about running into burning buildings to save the lives of others. They didn't think twice about working on a pile that burned with deadly fumes for months. So why is it taking our government so long to think about how they are going to prepare health care and provide health care to these heroes and these heroines? It is a national tragedy, a national shame. It is a scandal that we do not have permanent health care for these men and women who risk so much to save the lives of others. We need to take action now, to help the 9/11 responders and their families, the area residents, the workers. We need to help them cope with their illnesses and their losses, to care for the families of the responders who died, many in the prime of their lives. And John and I know them. We've met them. They were strong and healthy on 9/11. Months later, some cases years later, they're shells of what they were. They're throwing up black phlegm, and the city health department says it's not related to 9/11. Shame on you.
That's right. That's right.
We are the greatest country on earth. Why in the world have we not acted like a great country and taken care of the responsibility of these heroes and heroines? I'm listening to the presidential candidates. They're talking about health care for everyone, and I certainly support that. But let's start right now with permanent health care for those who risk their lives to save the lives of others. It is a scandal. We are pleased that the AFL-CIO, among many other good organizations, have endorsed our legislation. We have 71 co-sponsors, and I charge each of you to go out on your visits in Congress and get more co-sponsors. Our bill would ensure that everyone who was exposed to the deadly toxins is monitored, and everyone who is sick is treated. Our bill would reopen the Federal Victims' Compensation Fund to help the families and compensate them for their loss. We opened up this fund for the 3,000 that died on 9/11, and I applaud our government for doing it. But in some cases, these men and women who made a conscious decision to walk into the flames, to work on the burning pile, they are heroes and heroines too, and this fund should be opened up for them too.
Your great bill, under his great son's name, when we're done walking the halls of Congress today, we will get it passed. That's our promise to you.
That's a promise we need. We need to pass this bill. We need to move it forward to help these families. And I am willing to share your story. And I really look forward to hearing and talking to all of you. And I just have to say that we have a moral obligation to pass this. We need to pass this. The families deserve it. It's the least that we can do as a grateful nation. And I applaud your efforts today. And let's pull together to pass this bill now. We can't wait another year. 6.5 years is long enough. 6.5 years is long enough. Okay, thank you.
25 billion is not enough. 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 25 billion is not enough.
My great colleague Dennis Kucinich, who has worked on this bill for many years as the vice chair of the Oversight Committee on Health on the Government Reform and Operations Committee,